are like flashing lights of, okay, my baby clearly needs something. And then that's when our cravings like start to pop in of like, gosh, I'm just really craving salt, or like I need fish. Well, like that's the baby saying, okay, mama, I need some salt.
Mm.
I need salty foods. I need omegas because my
So
brain. Trust your gut with it. If you're like, well, if I can do these and the nutrition is feeding my baby, if I take this, how is it not getting to my baby and potentially affecting my baby?
Especially we see this in the Midwest a lot. Our Midwest moms want natural approaches to their deliveries. They want healthy babies, they want healthy pregnancies, and they want to stay healthy themselves. They don't want to be sick.
Right. And sometimes I think the struggle is like, as a woman, right, we envision what we want this birth experience to look like. But did we share that with anybody? Did we
That's
share that
true.
with our partner? Did we share that with our spouse? Did we share that with our care team?
Everybody, welcome back to the Prime Podcast. I'm your host, Dr. Skip Wyss, and I have the amazing and radiantly beautiful Dr. Julie Wyss with me today. How are you today?
I am great.
Yeah, I'm doing pretty good too, Dr. Julie. Say today, I want to touch on and walk through a subject here with you that you may or may not like. Let's just jump right into it, Dr. Julie. There's two camps with pregnancy. You obviously know what those are.
I was like, let's put the disclaimer. I like taking care of pregnancy. I like seeing pregnancy.
Okay.
I don't like to be pregnant.
You don't like being pregnant. No, she does not like being pregnant. In fact, she has some colorful words for it at times. But the result is always beautiful, right? And our kids are absolutely fantastic. We've had wonderful babies. Birth was a little bit suspect for both of our children. Wouldn't you agree?
Yeah, and I think that comes down to the principles of why we do everything that we do within our office.
Yeah.
Because if nobody talks about it, if nobody educates, or if you're not aware of these things, how are you ever going to find it out rather than going through and living it yourself?
Yeah.
So I think that's also, I'm sure what's going to come up today, but the reason behind everything that we do is because of things that we've experienced or information that we didn't have.
Well, we've dealt with a lot in 16 years, being together for almost 20 years, having children, a daughter and a son, being in two different birthing facilities. One for each kid is different. One was in Iowa, one was here in Green Bay, Wisconsin. But honestly, the results were still kind of the same. I would say that we prepped differently for our son than we did for our daughter. And I would say that Brecken's birth was probably, the post-birth was worse than Peyton for sure. For sure. We almost lost you.
Well, and I think it's like and I think what we're trying to get at is you can prep and plan for all the things that you know about, but there's always going to be potentially something that creeps up that you're not aware of.
Yep.
Right? Yep. I mean, so you think like, okay, we have all of this education. We think that we have all of the things put together and then put into, certain situations. That's why it's really sometimes easier for us as doctors to be able to give the outside guidance, the outside suggestions or knowledge, or just to lend that ear to listen. Because, like, let's be honest, when you're in the thick of it, it's really hard to make those decisions to know what is the best choice, what's the best option for both you, your family, and potentially your baby.
When moms first find out that they're pregnant, it's usually pretty fantastic after it all sets in. They get really excited. And then baby starts to develop inside mom, and then mom starts noticing little things. And you being pregnant, you're going to be way better at this than I am. But with Dr. Julie, what was the first thing you started to notice when we were pregnant? You were pregnant, sorry, I was just along for the ride.
You're along. Heartburn. I had, like, I didn't have morning sickness.
Nope.
And so I feel for all those that go through that. But heartburn and indigestion, I had that literally the entire pregnancy. So that was like an indicator for me, most certainly. Hormones are going all over the board. So headaches, you can get that, nausea, depending upon what type of shape that you're in before you're pregnant and then becoming pregnant, of like
You mean like
back
physical
pain,
shape?
sciatica. Yeah,
Okay.
there's so, I mean, mental, emotional. This could be like on
Yep.
so many different
So
levels.
how do you think then our moms out there, because I see it as a pretty strong cascade of events where something usually happens to
Mhm.
them later in pregnancy. That's why they usually come in, is most of our moms come in because they have sciatica, low back pain, round ligament pain.
Hemorrhoids,
What's that?
hemorrhoids.
Hemorrhoids, pain into their legs, varicosities into their
Mhm.
legs, something that's causing them a tremendous amount of pain. And honestly, their birth care provider, whether it's MD, midwife, doula, their hands are tied because they really can't help them, and they've been to physical therapy. They'll generally get referred to physical therapy. Physical therapy usually does not help. I'm sorry, but it doesn't, because there's still a misalignment to the pelvis, and they can sit there and try to align the pelvis as much as they can, but unless they're specific and really understand the nuances of it, they're not going to get the correct correction.
Well, it's because that's muscle, right?
Yep.
And that's where we need to focus on the nerves that
Bone nerve
control the
connection, right?
muscles.
Mm-hmm.
And then, so get that, the nerves communicating appropriately, and then also getting the vertebra, the bone, back to where it needs to be so we can get that communication. Then PT along together
Yeah, PT
works
is great
really
when we
well
have the right
together,
communication,
right?
because the brain is controlling those muscles. Regardless of you trying to stretch them out, heat them up, cool them down, ferential current them, interferential current them, use ultrasound, whatever you want, which is a form of heat as well, that isn't going to change the fact that it doesn't have proper communication. Therefore, it doesn't know when to relax and it doesn't know when to contract. So we need to have that communication there. We love working with physical therapists as long as we're working for the same result, and that's to get the mom better. And one is not better than the other. They work the best
They work
together
great
as a
together.
synergist, right? So these moms are coming in, and then so let's go back to this. I want to go back to this heartburn thing, because heartburn is a detrimental culprit to most of our moms, and we've touched on this in previous podcasts. Um, Heartburn can be not really, I don't want to say managed. It can be controlled. It can get worse through pregnancy. Yours just kind of stayed the same. It was rough right away. That's kind of how you knew you were pregnant with both the kids, as your heartburn started kicking up. But morning sickness, 50% of our moms have morning sickness. And it comes on fairly early. It starts right around that 5 to 6 week mark of being pregnant.
Sometimes, yeah, that's the,
Mm-hmm.
oh gosh, what's going on? Maybe that's the first time that you find out
Yeah.
that you're pregnant.
Yep, is why did
So
I
that
get
or
up in
food
the morning
poisoning.
and puke? Yeah, and or why am I up at night with nausea, or why am I nauseated through the whole day? And the first thing your care provider is going to say is, "Did you take a pregnancy test?" And to be quite honest with you, as chiropractors here in this office, we've found more moms pregnant than they've figured out before they even took the test. And I hope that came out correct. But
Well,
we've
it's
had it
kind
a
of,
lot of the
we have
times.
an inkling when, like, when
Mm-hmm.
we're seeing a family, all of a sudden, right, like sprung a baby, like our body does things totally different
Sure
because we're not
does.
set up to grow a baby every day. And so,
Right.
like, that's the amazing things of what we get to do, is that we can read the neurology in the body. Like, we can put our hands on somebody and something just doesn't feel right. And we're like, how do you do that? It's a little intuition, but it's just like, you understand, we are so connected with our patients that when we place our hands on something, it's kind of like, is your period late? Like, something's happening here, Catherine. Something
That
doesn't
blows their
seem right.
mind.
Like, what is going
Yeah.
on? They're like, oh, well, gosh, if you were thinking that, then I had been thinking that for 2 or 3 weeks. And it's like, okay, here's a pregnancy test. Let's go see what's
Let's
going
get this
on.
figured out, because we see these changes in pattern. We
Mhm.
see these changes in neurology, and that immediately will show us that something is changing, either adapting or compensating. And if you're pregnant, it's adapting. Your body's adapting. And we'll see these changes in our moms. We see these changes when they come in, and I see the same changes when they're breech. If a baby comes in and she's pregnant and baby's not in the right position, most of the time they are a very specific pattern to how their pelvis is aligned. And when that pattern changes and that baby moves and gets in the proper birth position, we start seeing changes in how that pelvis lines back up again. And we know it time in and time out. When we see those changes, it's like
It's
all of
so
a
much
sudden it's a
fun.
big change, right? And it makes a big difference. And yes, we chiropractors are very skilled at taking care of pregnancy if you get to the right ones that are certified. And that's certified in Webster's technique, certified through the ICPA, and really understand how pregnancy works, because there have been lots of conversations lately in the Green Bay public about poor pregnancy care. And it is alarming. And things should always be done to the utmost respect of the mom. We're always on top of clothes. We're never skin on skin. We're never below the belt line, skin on skin. Like, these are red flags that, as moms out there and potential moms when you're pregnant, if you've never been to a chiropractor, you need to call the doc and see what they do. Are they Webster's technique certified through the ICPA? What are they doing? What is their track record with helping moms with pregnancies? Because
What is
this
a
is super
success
important.
rate? Yeah, what
Success
is
rates, what's
mhm,
their dystocia rate? What's their cesarean rate like? How often do their moms carry full term?
mhm,
How many are going early? These are all stats we keep at Prime Family
mhm.
Chiropractic Centers because we like to know our data. We like to know where our moms are at. We like to know, are they ending up in cesarean or not? Was this something that was caused by X, Y, and Z? Was there a limiting factor?
Limitation.
So this is really, really important. Now, moms will also experience headaches during
Mhm.
pregnancy. And Dr. Julie, can you just elaborate a little bit more on headaches
Yeah,
and
so I
why
mean
this
the
is
headaches, I
happening?
mean hormones are changing,
Yep.
right? And like so even before a headache, we have to realize like our babies become needy as soon as they are like put together and they start to grow.
Yep.
So if we are not consuming the things in our diet, so our
Hmm.
regular food, but then actual not over the counter prenatals, like really good nutritious
Hmm.
supplements and vitamins, if we aren't feeding ourselves that, our babies are just going to start to take it from us,
Yeah, they do. They
and
they just take it.
they're just going to take it, just
Hmm.
like throughout childhood they're just going to keep taking and taking and taking from you.
They take a
So
lot.
you need to make sure that you are filling in those gaps, and
Hmm.
lots of times what we find is if those gaps aren't covered, or we're not getting the proper nutrition, hydration, and our hormones going like crazy, that's where we start to get those headaches.
Hmm.
And we can do all of the over the counter things to potentially try to help the headache,
Hmm.
but that's really pointing like clear, like flashing lights of, okay, my baby clearly needs something. And then that's when our cravings like start to pop in of like, gosh, I'm just really craving salt, or like I need fish. Well, like that's the baby saying, okay, mama, I need some salt.
Mm.
I need salty foods. I need omegas because my brain is growing that
It's
I
finding the
need these
deficiencies
things.
itself.
And so like we need to start to tune into those things, because a headache, yeah, maybe it is just the hormones, but most times there are multiple factors underlying of why we're getting that headache.
Yeah, and you hit on hormones, so I'm going to talk about breast tissue. And that's a big thing because that's one of the biggest things we see change in moms very early on
Mhm.
is breast tissue, and honestly bum tissue as well. Butts will change too, and thighs. But the breast tissue is a major source of weight on the front part of our mums. And if we don't have the right fitting bra, if we don't
Mhm.
have the right support, that can cause a lot of pressure into our shoulders, a lot of pressure with us coming forward, and then you don't actually escape it, because if you then choose to breastfeed and breastfeed for 6 months to a year, you have even more weight pulling you forward, plus baby. And what happens then is it starts pulling through your shoulders, and then we start getting tightness into our neck and then up into our head, which is causing these cervicogenic migraines, these cervicogenic headaches. And honestly, there is no better solution to help this than chiropractic care. You can take Tylenol. They talk about this stuff all the time, but that's the one non-steroidal that actually has the least amount of side effects. So they declare it somewhat safe. And I'm not saying whether it's safe or not, but I'm telling you right now, there are natural, more healthy solutions out there like chiropractic care, taking magnesium coupled with chiropractic care, making sure your nutrition and your nutrients are right for your body so your nerves can communicate the best they can, therefore getting you the best result that you want. That's the key, and to do it as natural as possible. Because moms out there, I mean, there are moms that as soon as they find out they're pregnant, they stop everything toxic into their body. They don't get their hair taken care of anymore, at least for a year. We've seen
Mhm.
that a lot. Like if they've gotten their hair colored, if they've had any sort of scalp treatments done, if they do anything woman related with chemicals, they stop immediately
Well, and
because
it's,
of the heavy metals, because of the
yep.
chemicals. So why would we want to be putting them in orally to try to prevent something or stop something that can easily be taken care of with chiropractic care?
And I think that's like the conversation of things passing through to my placenta, and it's kind of how can some things pass through and not other things, and lots of times there's really good marketing behind it. So trust your gut with it. If you're like, well, if I can do these and the nutrition is feeding my baby, if I take this, how is it not getting to my baby and potentially affecting my baby?
Well, baby has 300 times the blood flow of mom. Therefore, they're going to have 300 times the risk of exposure to any medication or anything put into your body than you, mom, because of how much the blood is cycling through them. So the exposure is up there. It's the same thing when we see kids that have baby acne after they're born because mom has had some sort of medical intervention, whether it's been some sort of drug or pain medication,
Epidural.
epidurals, all of this, something inducing labor, all of that. And if it's there long enough, will pass through you, mom, and then passes on to your baby because they're still attached to you via their umbilical cord until they're out of you. So that exposure is still there. And these are things that we see happen all the time. So we should be taking more of a natural approach. Especially we see this in the Midwest a lot. Our Midwest moms want natural approaches to their deliveries. They want healthy babies, they want healthy pregnancies, and they want to stay healthy themselves. They don't want to be sick.
Well, and I think it's, to start with of figuring out then who is on your birth team.
Yeah.
Because if we stick within the traditional realm of congratulations, you're pregnant, like the first step is, okay, I got to go see my obstetrician,
Mm-hmm.
right? And I need to do all of these things. Well, just like when you start to learn as you're growing your family, lots of information is very outdated.
Yep.
And to go into the obstetrician, yes, that's great to maybe, get a borderline and, check an assessment. But that usually starts ultrasound number one, and then ultrasound number two, ultrasound number three. Ultrasounds aren't needed. They're not warranted unless clinically significant if there are some concerns, especially with the 3D ultrasounds. Like we're
Mm-hmm.
putting more stress onto our baby. And so if we step back and if we're thinking, okay, I want to really hands off or I want to do as much natural as possible, it starts first with that provider that you are choosing to be a
Mm-hmm.
part of your team. And
Mm-hmm.
if that provider is strictly, I mean, an obstetrician, they go to school and they learn scalpels and knives.
Mm-hmm.
So
They're board certified
they're
surgeons.
surgeons.
Yeah.
And so you can't go in your head thinking, I want to have a hands off, all natural pregnancy when you're bringing a surgeon along with you
Yeah.
to that birth.
Yeah. And if you don't fit the timetable, it's not your decision anymore.
And again, it's not everybody is created equal. You have to
Yep.
do what you find comfortable. But if you are already stacking the deck against the things that you want, like, and we've seen it unfortunately, like, oh yes, we will give you that type of experience. It's not a I will give you that. You need to demand it.
Or we'll let you
You need to
try.
take
That's
control
one
of
of the
those.
biggest things that bothers me is when we hear the word try. Look at a mom, it's their second pregnancy, maybe they had a cesarean their first time, and we'll let you try or attempt a VBAC, which means vaginal birth after cesarean, but they've changed that too. It's now a VBAC for attempt, not actual doing. We'll let you try for a VBAC, but in their mind, when they say try, like you don't try, you do. Like either you're gonna do it or you're not. Now there still could be complications there. I'm not downplaying that, but I don't like the word try. I don't like the wording behind it. It doesn't empower our moms at all. Let's get them empowered. Let's get them working towards this because prepping for labor is no joke. And from a dad's perspective and seeing my wife go through it twice now, it there's a lot to it.
It is literally the race of your lifetime
Mm-hmm.
for your child. Like that is like the biggest event they will ever go through. And sometimes it's pushed aside lightly, like it's
Yep.
not that big of a deal. Or, well, don't worry if you give up or if you're tired and talk about we can do all of these other things to
Mm-hmm.
assist. And again, that's taking you off the beaten path if that's truly what you wanted. So like if anything, if for you moms of just to feel empowered that our bodies are made and designed to be able to grow, so grow the baby, right, and then be able to deliver the baby and recover from that pregnancy. We don't need somebody else to take that away from us.
Yeah, and that is one thing that you need to be empowered for. Sometimes male providers can do a great job at that. Sometimes female providers don't do a great job at that. The moms feel judged. They feel like they're being constantly under scrutiny with female providers. Same thing will happen with male providers. But the biggest thing I hear back from women when they come in, my moms, and talk about their male provider is they'll say, he was just kind of a jerk. That's what they say. He wasn't very nice. He was rude. But I've never, very few have I ever had in that have said, I felt judged, I felt belittled, I felt like I couldn't do it. They made me feel like I was inferior. And I hear that a lot when there is a female birth provider that isn't liked. I'm not saying it happens all the time. Let's be real on it. Let's be right up front with that. But when it does happen, those are the words that come out. Male provider was kind of a jerk. He was cold. He wasn't real nice. Female provider, judged, scrutiny, belittled, felt like I wasn't equal. Like, these are all things that happen. So it's on both sides of it. But the perception is different. And the way it comes across is different. But if we can provide love and support and just help build that mom up and let her know that she is designed to give birth, she is designed to have those babies, like that's what she's been put on this earth to do, she can do it. You can do it. You did it twice. We have moms that have done it 9, 10, 11 times. I mean, they have. And the thing is every time they have a baby, it's a different story. And my favorite is when it's a happy story. I feel really bad when it's not a happy story. When I ask mom how birth went and she doesn't want to talk about it, it wasn't what she expected. It wasn't what she had built it up to be in her mind. And a lot of the times it doesn't go that way when things are rushed, when they're pushed, when they're induced. We just had a mom in that started care with her little one. She was in labor for over 30 hours and then ended up and resulted in an emergency C-section. 30 hours.
Well, and I think it goes back to, okay, if anything, let's figure out maybe before you're pregnant of who do you want on your birth team, right? And sometimes I think the struggle is like, as a woman, right, we envision what we want this birth experience to look like. But did we share that with anybody? Did we share that with our partner? Did we share that with our spouse? Did we share that with our care team? So part of that is also on us that we can't navigate all of that ourselves.
You need to communicate.
So we need to have that communication. We need to have a written, birth plan. We need to, hire and fire until we find the right people that we want on our team. And like, there is no reason that even before you're pregnant, if you're like, okay, I want to be starting a family, start looking for that team now already. Like, we can go down epigenetics. We can talk about, okay, let's get the two perfect, well communicating brain and body, to make the best possible sperm and egg to come together to make that baby, right? So then that's like care, even chiropractic care before we're even thinking about starting a family. So then ultimately, once we start, we have everything 100% communication, 100% function to have the best start to life.
Yes, that's exactly what I want for every man, woman, and child in what they've been through. And if these traumas are starting during delivery, if they're starting during them being carried inside mom, they can instill the rest of their life, and they can negatively affect them the rest of their life. And that's not okay with me. I want to be able to be that pattern interrupt and change things. I want to help. That's why we got into this. That's why we talk about this every week. That's why we're on here trying to get our voice out to the world, because we just want to help and help these families be happy and healthy.
Well, I think that's, everybody's talking about like childhood traumas. Like, this is in utero trauma, right? We're seeing the effects of the amount of mental health and the concerns that are on the rise. Well, if we think back to what COVID was, right, of how much stress was on literally everyone, and we didn't think about the unborn child, right? But now these kids are 2, 3, 4 years old, and we wonder why they have such anger issues, why there's such disconnect, why ADHD, all of these things are on the rise, and we're, trying to figure out what's going on with our mental health. It has everything to do with the stressors in our life.
Well, if your mental health is off and your stress is up, your cortisol is off, and that's affecting baby as well. So we've seen that where baby comes out addicted to cortisol. We've seen that where they come out in a massive stress response instead of a rest and digest response. Some of that's protective and needed, but some of it's an overkill because baby's already super stressed. So chiropractic and what we've done here in our profession and how we teach it, it changes mom's lives, it changes pregnancy, and it changes the baby's life. That's why we love dealing with pregnancy so much, especially when you find one that's fired up as we are with chiropractic and pregnancy care. And that's what we do here. So, Dr. Julie, is there anything else you want to talk about or
No, I feel
contribute
like
this
we could
week?
talk on this for
And we
hours,
probably will.
though.
And that's the thing, is we're going to touch on this back and forth all year. And if you know anybody out there that could benefit from hearing this, please share it with them. Share it on Facebook, share it on Instagram, send it to them in an email. Just click the link below, share, and it's going to give you the link. Subscribe, give us a thumbs up, get more people over here so they can start listening to what we have to say. But the most important thing is so you can start becoming part of the community and having a community there of people and like-minded men, women, and children to start growing these amazing families as healthy as possible. So go out there, get it done, everybody. Have an incredible week. Bye, everyone.